Imagine waking up in the morning with a strange and uncomfortable sensation deep in your lower abdomen. At first, it feels like a normal urge to use the bathroom, something you've experienced countless times before. You head to the toilet expecting quick relief, but nothing happens. Minutes pass. You shift positions, wait a little longer, and try to relax. Yet your body refuses to cooperate. Frustration begins to replace patience. A little later, you try again. Still nothing. Perhaps you tell yourself that a hot drink or a bit of movement will get things going. But as the hours pass, the discomfort grows. What started as a simple inconvenience slowly becomes a source of concern. A dull pressure develops low in your pelvis. Your lower back begins to ache. Your stomach feels unusually heavy and bloated. You may even notice that you feel tired, sluggish, or slightly unwell without understanding why. For many adults, especially those over the age of 60, this situation is far more common than people realize. Yet it is rarely discussed openly. Most people assume it is just constipation and expect it to resolve on its own. Unfortunately, that assumption can sometimes be dangerous. Welcome to Vital Aging. Today, we are talking about a serious digestive issue that affects millions of older adults every year. Stool that becomes trapped and physically stuck inside the rectum. We will explore what causes it, why it develops gradually, the warning signs many people miss, and most importantly, the practical steps you can take before it turns into a medical emergency. By the Section 6. There comes a point when home remedies are no longer enough, and recognizing that moment is incredibly important. Many people continue trying the same approaches repeatedly, hoping the problem will eventually resolve itself. Unfortunately, waiting too long can allow the blockage to become larger, harder, and more difficult to treat. If you have attempted reasonable at-home measures and still cannot pass stool, or if your symptoms continue worsening, it is time to seek professional medical care. This is not a sign of failure. It is a smart and responsible decision that can prevent much more serious complications later. When you arrive at an urgent care center or emergency department, healthcare professionals have access to tools and treatments that are not available at home. One of the first steps may involve a physical examination to determine the location and severity of the blockage. In many cases, imaging studies, such as abdominal x-rays or other scans, may be used to evaluate how extensive the impaction has become and whether additional complications are developing. Medical teams can also administer specialized enemas designed to deliver fluid higher into the bowel than most over-the-counter products can reach. These treatments help soften hardened stool and may encourage the bowel to empty more effectively. Because they are performed under medical supervision, healthcare providers can monitor your response and adjust treatment as needed. In some situations, the blockage is simply too large or too compacted to respond to less invasive measures.